So you see in the first slide itself, you can see that fat, minerals, amino acids, carbohydrates, these are all included under the TPN. It is a total parenteral nutrition. Then in the second slide, this is the form of the TPN we are going to give to the patient. Okay, the solution will be transparent. It will be given through the IV line, whether through the peripheral line or through the central line. Then definition: intravenous, it is intravenous administration of varying combinations of hypertonic or isotonic glucose, lipids, amino acids, electrolytes, vitamins and trace elements through a venous access device. Okay, venous access device, whether central line or peripheral line, directly into the intravascular fluid to provide the nutrients for the patients who are unable to receive adequate nutrition through the gastrointestinal tract. So in the patients who are not able to eat or drink, or who are not able to take the required elements, okay, who are not able to take the required elements through even through the even through the nasogastric tube, okay, even through the nasogastric tube, if they are not able to get, that means they are required to take this total parenteral nutrition. So the purpose to provide nutrients, okay, for the normal metabolism. Then indications: patients who cannot tolerate enteral nutrition because of paralytic ileus. Paralytic ileus means obstruction of the intestine due to paralysis, okay, paralysis of the intestinal muscles. Then in the intestinal obstruction, if there is any obstruction in the intestine, acute pancreatitis, inflammation or infection of the pancreas. Then inflammatory bowel disease, that means there will be inflammation inside the intestinal tract. Then gastrointestinal fistula, there will be abnormal opening in the gastrointestinal tract or the digestive tract. Then diarrhea, severe diarrhea, who have persistent vomiting or who have patients who have malnutrition. Then patients who are in hypermetabolic state, like patients who are having severe burns, okay. Then patients who are advised for NPO, that is nil per oral, for more than 5 days. Then patients who are having acute renal failure, multiple fractures, tumor in the GI tract. So patients who are at risk of malnutrition, like gross underweight and metastatic cancer. So these are all the patients who will be eligible, so okay, for taking the TPN. These are the indications. Then the methods of parenteral nutrition is divided into two: peripheral parenteral nutrition and total parenteral nutrition. Peripheral parenteral nutrition, it may be either through the peripheral line, okay, you know, the peripheral line which is connected in the periphery, like our hands and feet, okay, through the IV line. Then total parenteral nutrition is given through the central line. Here, first one is a total parenteral nutrition. In the total parenteral nutrition, it is indicated for patients requiring parenteral feeding for more than 7 days, given through a central line, okay. Then it contains CHO, these carbohydrates, proteins, lipids, water, minerals and vitamins. Then next, in the peripheral parenteral nutrition, this is given through peripheral vein, okay, then indicated for patients requiring nutrition for less than 7 days. In the total parenteral nutrition, more than 7 days. In the peripheral, less than 7 days. And in the peripheral, it is given through the peripheral vein. In the total, it is given through the central vein. Then in the total parenteral nutrition, it contains all the elements like carbohydrates, proteins, fats, lipids, vitamins and minerals. Then in the peripheral, it contains carbohydrates as lesser concentrated glucose solution with amino acids, vitamins and minerals. So the articles include central venous access device, okay, like the central line. Then volume control infuser. Then filters. So In slide number 12, you can see the central venous access device. Whether it may be for peripheral, we can use the IV cannula, and for the central line, we have to use a certain device to insert through the central vein. Okay. Then volume control infuser. So this volume control infuser, it will control the volume of the flow rate. Okay, it control the volume of the fluid which is coming from the TPN into the patient's body in a certain amount. Then filters. These filters are used to this is attached to the IV line. Okay, this is attached to the IV line, which will be attached to the this one central venous catheter. So this filter will reduce the risk of particles which will be entering inside the patient. This will filter out the unwanted particles. Then articles include bag of parenteral nutrition, the bag which we have seen in this second slide. Then administration tubing with lower lock connection. Lower lock connection, it is a type of connection to prevent the leakage. Okay, this is a very secure lock which we will connect before connecting to prevent the leakage. Then hypoallergic tape, this is the normal tape which we use. Then face masks, sterile gloves. The next comes a procedure. Before performing the procedure, we have to perform the nutritional assessment, check the physician's order, explain the procedure to the patient, inform consent. Okay, we have to take the informed consent while doing a procedure. Okay, we have to take informed consent. Whether we have to take informed consent or not, it should be clearly seen by staff nurses before doing the procedure. Okay, then remove the bag of the parenteral nutrition from refrigerator at least 1 minute, at least 1 hour before the procedure. If the TPN bag is kept inside the refrigerator, that means we will take out the TPN bag 1 hour before procedure. Okay, to decrease incidence of hypothermia, pain, and vasospasm. Then inspect the fluid for the presence of creamy or any change in the constitution. The fluid should be clear, okay, without any clouding. If there is any clouding, then there is some problem. We can give it directly. If there is any clouding, we should always inspect the fluid before giving. Then wash hands, cap, masks, gown, sterile gloves. We should all put this on foot to follow the aseptic precautions. Then after this, we will have the physician with attaching with insertion of the venous access device like this. It means we will assist the physician while giving the central line. Okay, central line is to be done by the physician only. Then if the patient is having the central line from earlier, then we can directly do the connections. After insertion, make sure that the connection is secure using lower lock connection. Then open all clamps, regular flow volume through the volume control infuser. We will use a volume control infuser to open all the clamps and monitor administration early. Okay, we should inspect if there is any complications, if there is any discomfort during the administration of the TPN. Then assessing for integrity of fluid and administration system and patient tolerance. Then after that, we should record the procedure. So this is the procedure. Then we have the clinical data monitored daily. This all should be vital signs, fluid balance. This all should be monitored daily. Then we should also see the glucose level. Okay, then blood glucose, sodium, potassium, chloride, urea, creatinine, albumin. This all should be seen, because in the complications we can see that the patient will either be having severe electrolyte imbalance, or like having hyperglycemia or hypoglycemia. That means high level of sugar or low level of sugar. So we should check this daily if the person is getting the continuous TPN. Okay, then how we will discontinue the TPN? We cannot directly put off the TPN like we do while doing the IV fluids. Okay, well, before the discontinuation of the TPN, what we will see, discontinuation of TPN should take place when the patient can satisfy 75% of his or her caloric and protein needs with oral intake or enteral feeding. Okay, through the NG tube or through the oral. If the person is able to satisfy his 75% of caloric needs, then after that only it should be continued. Then to discontinue the TPN, the infusion rate should be half for 1 hour, half again for the next hour, then discontinued. Okay, this means that if the patient is getting for example, okay, I will say, for example, if the patient is getting 20 drops per minute, okay, if the patient is getting 20 drops per minute, then for 1 hour, okay, for 1 hour it should be done in 10 half. Okay, it should be half. That means half of 20 is 10, so it should be level at 10 drops per minute. Then after that, after 1 hour again, it should be turned to half again, that is half of 10, that is 5 drops per minute. Then after 5 drops per minute keeping for 1 hour, then it should be discontinued. Then tapering in this manner prevents a rebound of hypoglycemia and hyperinsulinemia. Okay, hypoglycemia, that means low level of sugar, then hyperinsulinemia, high levels of insulin. So it is not necessary to taper the rate if the patient demonstrates glycemic stability. If the patient has normal sugar level, then it is not necessary to taper. But if the patient is having this instability of the glycemic sugar, it should be tapered. Tapering means slowly reducing the amount of flow. Then in the complications we can see sepsis, okay, electrolyte imbalance, hyperglycemia, hypoglycemia, hypervolemia, hepatic dysfunctions, hypercarbia. So these are all the complications that you can see during while giving this total parenteral nutrition. So I hope you all understand what you mean by TPN, parenteral nutrition. It can be given in in two forms, that is peripheral and central line. The central line, through the central line, the total parenteral nutrition can be given, and through the peripheral line, peripheral parenteral nutrition can be given. Then the methods, indications, and how purposes and articles, procedures, all we have discussed today. So if you are having any doubt, ask me.